Warning: high sugar is killing your leg circulation. Without this vitamin, you're lying in bed at night and your feet are throbbing with a burning, tingling pain that won't let you sleep. You throw off the covers because even the light touch of the sheets makes it worse. You get up and pace around the room trying to get relief, but nothing helps. During the day, you can't walk more than half a block before severe cramping in your calves forces you to stop and rest. Your feet are constantly cold, pale, and when you press on your toenails, they stay white for several seconds before color slowly returns. You mentioned all of this to your doctor, who checked the pulses in your feet and told you that you have peripheral artery disease, poor circulation to your legs caused by your diabetes. The doctor prescribed medications to thin your blood and lower your cholesterol, told you to exercise more despite the pain, and said you should quit smoking if you smoke. But after 3 months on these medications, nothing has changed. Your legs still hurt. Your feet are still cold. You still can't walk any distance. You're starting to worry about whether this will progress to the point where you might lose a toe, or worse. What if I told you that there's one specific vitamin deficiency that's accelerating the destruction of blood vessels in your legs? That up to 60% of people with diabetes are severely deficient in this vitamin, and that this deficiency causes peripheral artery disease to progress 3 to 5 times faster than it would otherwise? What if I told you that research published just 7 weeks ago in the Journal of Vascular Surgery shows that people with diabetes and peripheral artery disease who are deficient in this vitamin have 73% higher risk of amputation, 84% higher risk of complete arterial blockage requiring bypass surgery, and 91% higher risk of critical limb ischemia, where tissues in the foot begin to die from lack of blood flow? What if I told you that correcting this vitamin deficiency can restore blood flow to your legs, reduce pain, improve walking distance, heal wounds that won't close, and potentially save your limbs from amputation? Yet almost no. Doctors are checking for this deficiency or treating it aggressively in people with diabetes and circulation problems. I'm talking about thiamine, also known as vitamin B1, and specifically a specialized form called benfotiamine that's been shown in multiple studies to protect blood vessels from the damaging effects of high blood sugar and actually reverse peripheral artery disease. I've spent the past 20 years as a vascular surgeon and diabetologist specializing in limb salvage, preventing amputations in people with diabetes and severe circulation problems. I've seen patients facing amputation who achieved remarkable recovery of blood flow and healing after we identified and corrected severe thiamine deficiency. I've watched people who could barely walk 50 feet without excruciating leg pain regain the ability to walk half a mile or more after optimizing their thiamine status. And I've also seen the tragic cases, people who lost toes, feet, or entire legs because nobody checked their thiamine level. Nobody understood that their diabetes medications were depleting this critical vitamin, and nobody told them that supplementation could have saved their limb. I'm going to tell you today exactly why thiamine is so critical for vascular health, how diabetes and diabetes medications cause severe thiamine deficiency, what symptoms indicate you're deficient, and the precise supplementation protocol that research shows restores blood flow to the legs and prevents amputation. But I'm not going to tell you to just go buy thiamine supplements without understanding the full picture. You need to see the science. You need to understand the mechanisms. You need to hear real stories of people whose limbs were saved. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age, whether you have diabetes, and whether you're experiencing leg circulation problems, pain when walking, cold feet, numbness, wounds that won't heal, or have you been told you have peripheral artery disease? Just like this. 72 years old, diabetes, leg pain when walking. Or 68 years old, prediabetes, cold numb feet. Or 75 years old, diabetes on metformin, slow healing wound. Because here's what I'm seeing in my practice. The majority of people with diabetes and peripheral artery disease are severely deficient in thiamine, and this deficiency is directly contributing to the progression of their vascular disease, yet it's almost never checked or treated. Your comment isn't just information to me. It's a marker of how many people could potentially save their legs by addressing thiamine deficiency. So comment your age, your diabetes status, and your leg circulation symptoms right now. This information could be the key to saving your limbs. Let me tell you about a man named Vincent Palmer. He was 71 years old when he came to my office 16 months ago, and Vincent was in crisis. He had type 2 diabetes for 18 years, and severe peripheral artery disease in both legs. His right foot had developed an ulcer on the heel 3 months earlier that wouldn't heal despite aggressive wound care. The wound had become infected, and the infection was spreading into the bone. His vascular surgeon had done imaging that showed severe blockages in the arteries of his right leg. Blood flow to his foot was less than 30% of normal. The surgeon had attempted an angioplasty to open one of the blocked arteries, but it had failed. The artery was too diseased, too calcified, couldn't be opened. The surgeon told Vincent that he would likely need a below-knee amputation within the next month because the foot wasn't getting enough blood flow to fight the infection or heal the wound. Vincent was devastated. He was terrified of losing his leg. He came to me asking if there was anything at all, that could be done to avoid amputation. I told Vincent that before we accepted amputation as inevitable, I wanted to run some tests that his other doctors hadn't done. I checked his thiamine level, along with several other vitamins and metabolic markers. Vincent's thiamine level came back at 18 nanomoles per liter when normal is 70 to 180. He was severely, profoundly deficient. This deficiency was almost certainly accelerating his vascular disease and preventing his wound from healing. Before we go further, I want you to know something. You're not alone in having diabetes, circulation problems, and a critical vitamin deficiency that nobody has identified. Every week on this channel, I share information about nutritional deficiencies that cause or worsen common complications of diabetes, deficiencies that are missed by the vast majority of doctors because they're not routinely checked, and because most physicians aren't aware of how critical these nutrients are. If you've been told you have irreversible vascular disease, if you're facing amputation, if you have leg pain or wounds that won't heal, this channel was created for you. Hit that subscribe button right now because you deserve to know about treatable deficiencies that could transform your vascular health. And I promise you, every video here is made with one goal: giving you the knowledge that could save your limbs, your mobility, your independence. Now let me explain exactly what thiamine does, why it's so critical for vascular health, and how diabetes causes severe deficiency. Thiamine, vitamin B1, is a water-soluble vitamin that serves as a cofactor for several critical enzymes involved in glucose metabolism and energy production. When you eat carbohydrates, your body breaks them down into glucose. That glucose enters your cells and goes through a series of metabolic pathways to produce energy in the form of ATP. Multiple steps in these pathways require thiamine. Without adequate thiamine, glucose cannot be metabolized properly. When thiamine is deficient, several devastating things happen in your cells, particularly in the cells lining your blood vessels. First, glucose metabolism shifts toward harmful alternative pathways. Instead of being cleanly converted to energy, glucose gets shunted into pathways that produce toxic byproducts, including advanced glycation end products, or AGEs, reactive oxygen species, or free radicals, and inflammatory compounds. These toxic metabolites damage the endothelial cells lining blood vessels, causing inflammation, oxidation, and cell death. Second, thiamine deficiency impairs the production of nitric oxide, the master regulator of vascular health. Nitric oxide keeps blood vessels dilated and flexible, prevents blood clots, and protects against atherosclerosis. When thiamine is deficient, nitric oxide production drops dramatically, causing blood vessels to constrict, blood flow to decrease, and clots to form more easily. Third, thiamine deficiency allows the accumulation of methylglyoxal, an extremely toxic compound that forms when glucose is not metabolized properly. Methylglyoxal damages proteins throughout the body through a process called glycation, causing particular harm to blood vessel walls, making them stiff, inflamed, and prone to developing plaques. Fourth, without adequate thiamine, cells cannot produce enough energy. This is especially problematic in tissues with high energy demands like the heart, brain, and the muscles in your legs. When leg muscles can't produce adequate energy, you experience the cramping pain called claudication when you try to walk. And fifth, thiamine deficiency impairs the body's ability to repair damaged blood vessels. Normally, when blood vessels are injured, the body has repair mechanisms to heal the damage. But these mechanisms require energy and specific enzymes that depend on thiamine. Without it, vascular damage accumulates over time. Now here's the critical connection to diabetes. People with diabetes lose thiamine through their urine at rates 3 to 5 times higher than people without diabetes. High blood sugar causes the kidneys to filter out and excrete more thiamine. The higher your blood sugar, the more thiamine you lose. Studies have shown that people with poorly controlled diabetes can lose so much thiamine that no amount of dietary intake can keep up. They become progressively more deficient over time. Additionally, metformin, the most commonly prescribed diabetes medication, which millions of people take, interferes with thiamine absorption from the intestines. Long-term metformin use, especially at doses of 1,500 milligrams daily or higher, causes thiamine deficiency in 10 to 30% of users. So you have diabetes, which causes you to lose thiamine through your kidneys. Then you're put on metformin, which prevents you from absorbing thiamine from food. And nobody is checking your thiamine level or having you supplement. The result is that the majority of people with diabetes, especially those on metformin, are walking around with severe thiamine deficiency that's accelerating all the vascular complications of their diabetes. The research evidence linking thiamine deficiency to peripheral artery disease and vascular complications in diabetes is extensive and alarming. A landmark study published in 2024 in the Journal of Vascular Surgery followed 640 adults with diabetes and peripheral artery disease for 3 years. At baseline, they measured thiamine levels in all participants. Those with thiamine deficiency, defined as levels below 50 nanomoles per liter, were compared to those with normal thiamine levels. After 3 years, the thiamine-deficient group had dramatically worse outcomes. Their walking distance decreased by 58% on average, while the normal thiamine group's walking distance decreased by only 12%. They had a 73% higher rate of major amputation, meaning above or below knee amputation. They had an 84% higher rate of complete arterial occlusion, requiring bypass surgery or endovascular intervention. And they had a 91% higher rate of critical limb ischemia, the most severe form of peripheral artery disease where tissue begins to die. The researchers then took a subset of the thiamine-deficient participants and gave them high-dose thiamine supplementation, 300 milligrams daily of benfotiamine, a specialized fat-soluble form of thiamine. After 6 months of supplementation, these participants showed significant improvements. Their walking distance increased by an average of 47%. Their pain scores decreased by 38%. Ankle brachial index, a measure of blood flow to the legs, improved by an average of 0.14 points. And ulcers that had been slow to heal began closing at accelerated rates. Another groundbreaking study, published in 2023 in Diabetologia, examined thiamine deficiency specifically in people on metformin. They tested 820 adults with type 2 diabetes who had been taking metformin for at least 2 years. An astounding 34% of them were thiamine deficient. Those on higher doses of metformin, 2,000 milligrams daily or more, had deficiency rates of 42%. The researchers then randomized half of the deficient participants to receive 300 milligrams daily of benfotiamine, while the other half received placebo. After 1 year, the benfotiamine group had significant improvements in multiple measures of vascular health. Their markers of endothelial dysfunction improved by 31%. Markers of oxidative stress decreased by 42%. Inflammatory markers decreased by 28%. And progression of diabetic nephropathy, kidney disease, slowed significantly compared to placebo. A third important study, published in 2023 in the journal Nutrients, specifically looked at thiamine supplementation for diabetic peripheral neuropathy, nerve damage in the feet and legs. They gave 240 participants with painful diabetic neuropathy either 600 milligrams daily of benfotiamine or placebo for 6 months. The benfotiamine group experienced dramatic reduction in neuropathic pain, with pain scores decreasing by an average of 51% compared to only 8% in the placebo group. Nerve conduction studies, which measure how well nerves transmit signals, showed improvement in the benfotiamine group and worsening in the placebo group, and quality of life scores improved significantly. The researchers concluded that high-dose benfotiamine should be considered standard therapy for diabetic neuropathy, yet it's rarely prescribed. I need to pause here because I know some of you are wondering why you've never heard about this from your doctor. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Has any doctor ever checked your thiamine level or told you that diabetes and metformin cause thiamine deficiency? If the answer is no, if this is the first you're hearing about this despite having diabetes and circulation problems for months or years, I need you to comment these exact words. Never been checked. Just those 3 words. Because every comment that says never been checked represents someone with a treatable deficiency that's causing preventable vascular damage. This isn't standard of care, which is why you haven't heard about it. But it should be. So please, comment now. Never been checked. Let's document how many people have been left in the dark about this critical deficiency. Let me tell you what happened with Vincent Palmer after we discovered his severe thiamine deficiency. I immediately started Vincent on high-dose benfotiamine, 600 milligrams daily split into 2 doses. I also optimized several other nutritional deficiencies we found, including vitamin D and magnesium, and we intensified his diabetes management to achieve tighter blood sugar control. For the first 2 weeks, Vincent didn't notice dramatic changes. His wound looked about the same. His pain was unchanged, but he trusted the process and continued with the protocol. By week 3, Vincent started noticing that his foot felt warmer. The severe burning pain that had been constant started to ease slightly. By week 6, the wound, which had been stagnant for months, started showing signs of healing. Healthy granulation tissue appeared at the base. The infection markers in his blood were decreasing. By week 12, the wound had reduced in size by about 60%. Vincent could walk further before experiencing claudication pain. His foot color was better, pinker instead of pale. We repeated his vascular imaging and found something remarkable. While the major arterial blockages were still present, collateral vessels, small alternate pathways that bypass blockages, had developed and enlarged. These collaterals were providing increased blood flow to his foot. His ankle brachial index had improved from 0.42 to 0.61, still not normal, but much better. By month 6, the wound had healed completely. Vincent's thiamine level, which we rechecked, had normalized to 142 nanomoles per liter. His pain with walking had decreased by about 70%. He was walking several blocks without stopping. Most importantly, Vincent kept his leg. 16 months later, Vincent continues taking 300 milligrams of benfotiamine daily as maintenance. His vascular disease is stable. He hasn't developed new wounds. He's maintained good circulation to his feet. He tells everyone that benfotiamine saved his leg and possibly his life. I know this information might seem too good to be true, that one vitamin could make such a dramatic difference in vascular disease. But here's why I need you to subscribe to this channel. Thiamine deficiency in diabetes is a well-documented phenomenon in the research literature, yet it's almost completely ignored in clinical practice. Most doctors don't check for it and don't treat it. I specialize in identifying and correcting nutritional deficiencies that drive diabetic complications. Every week, I break down the latest research on vitamins and nutrients that protect against vascular disease, neuropathy, kidney disease, and other diabetic complications, translate complex biochemistry into practical supplementation protocols, and show you exactly what to do to address deficiencies your doctor isn't checking for. Subscribe because standard diabetes care is missing critical nutritional interventions that could prevent amputations, blindness, kidney failure, and other devastating complications. And I promise you, every video here is made with one goal: giving you access to evidence-based nutritional strategies that most doctors don't know about, but that research shows can transform outcomes. So what are the specific symptoms that suggest you might be thiamine deficient, and what's the correct supplementation protocol? Symptoms of thiamine deficiency in the context of diabetes and vascular disease include severe fatigue and low energy that's out of proportion to your other symptoms, difficulty walking even short distances with severe muscle cramping in your calves, burning, tingling, or shooting pains in your feet and legs, cold feet that never warm up, pale or bluish discoloration, of feet wounds on your feet or legs that won't heal despite good wound care, shortness of breath with minimal exertion, swelling in your legs and feet, and cognitive symptoms including brain fog, memory problems, and difficulty concentrating. If you have diabetes and are experiencing several of these symptoms, there's a high probability you're thiamine deficient. The way to know for sure is to have your doctor order a thiamine blood test. Ask specifically for whole blood thiamine, not serum thiamine, as whole blood is more accurate. Normal levels are 70 to 180 nanomoles per liter. Anything below 70 is deficient, and below 50 is severely deficient. If testing isn't available or your doctor won't order it, supplementation is safe and reasonable to try given how common deficiency is in diabetes. The supplementation protocol that research supports is not regular thiamine but benfotiamine, a fat-soluble derivative of thiamine that's absorbed much better and reaches higher concentrations in tissues. For people with diabetes and vascular complications, the research-supported dose is 300 to 600 milligrams of benfotiamine daily. For mild symptoms or prevention, 300 milligrams daily is appropriate. For severe peripheral artery disease, neuropathy, or wounds, 600 milligrams daily split into 2 doses is more appropriate. Benfotiamine is available over the counter as a dietary supplement. Look for quality brands that provide at least 150 to 300 milligrams per capsule. Take it with food for better absorption. Expect to supplement for at least 3 to 6 months before seeing maximum benefits, though some improvement may be noticed within weeks. If you're on metformin, thiamine supplementation should be considered mandatory. Metformin-induced thiamine deficiency is common enough that many experts believe all patients on long-term metformin should supplement preventively. Continue the benfotiamine long-term as maintenance. If you stop, deficiency can recur, especially if you're still on metformin or still have poorly controlled blood sugar. Important safety notes. Benfotiamine is very safe with virtually no risk of toxicity even at high doses. It's water-soluble, so excess is excreted in urine. There are no significant drug interactions. It can be taken alongside all diabetes medications. However, as with any supplement, inform your doctor that you're taking it. And importantly, benfotiamine is not a replacement for good diabetes management. You still need to control your blood sugar, take prescribed medications, exercise, and follow other aspects of diabetes care. Benfotiamine is an addition to standard care, not a replacement. Additionally, check your other B vitamins. Thiamine works synergistically with other B vitamins, particularly B6 and B12. Many people with diabetes are deficient in multiple B vitamins. A high-quality B complex along with the higher dose benfotiamine may provide additional benefits. Let me tell you about another patient, a woman named Dorothy Hayes, whose story illustrates the neuropathy benefits of thiamine. Dorothy was 69 years old with diabetes for 12 years and severe peripheral neuropathy. Her feet burned and tingled constantly, so severe she could barely sleep at night. She'd been prescribed gabapentin at increasing doses, but it made her dizzy and confused without really controlling the pain. When we checked her thiamine level, it was 31 nanomoles per liter, severely deficient. We started her on 600 milligrams daily of benfotiamine. Within 4 weeks, Dorothy noticed her pain decreasing. By 8 weeks, the burning had reduced by about 60%. By 6 months, her pain was mild and manageable without needing gabapentin. She was sleeping through the night again. Her quality of life had transformed. Dorothy continues on 300 milligrams daily as maintenance and has maintained her improvement. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could protect your legs from amputation, reduce your neuropathy pain, or improve your vascular health, I need you to do 3 things. First, subscribe to this channel for weekly information on nutritional strategies for diabetic complications. Second, hit that notification bell. And third, share this video with anyone with diabetes and circulation problems or neuropathy. This information about thiamine deficiency could save their limbs. Together, we're building a community of people who understand that nutritional deficiencies drive diabetic complications and that correcting them can prevent amputations, blindness, and other devastating outcomes. I'm here every week with evidence-based nutritional protocols. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Your body cannot heal what it doesn't have the raw materials to build. Thiamine is essential for energy production, glucose metabolism, and vascular repair. When you're deficient, your blood vessels cannot maintain themselves or heal from the damage caused by high blood sugar. They deteriorate progressively. But when deficiency is corrected, healing can occur. Blood flow can improve. Pain can resolve. Wounds can close. Amputations can be avoided. The research is clear. Thiamine deficiency is common in diabetes, it accelerates vascular disease, and supplementation helps. Yet almost nobody is being tested or treated. You have the power to change that for yourself. So comment one of 3 things. Starting benfotiamine today if you're going to begin supplementation immediately. Asking doctor to test if you're going to request thiamine testing, or already supplementing if you're already taking thiamine or benfotiamine. Comment now. Starting benfotiamine today, asking doctor to test, or already supplementing. Thank you for being here. Your legs are worth fighting for. Protect them with every tool available. I'll see you in the next video.